In this lesson, we're going to take a look at some tips to help you document like a pro. As experienced nurses, we've gone through this time and time again where our documentation is never flawless, and you should expect the same. Just expect that you at some point will make an error in your documentation. The big thing to understand is that you can recover from this and you can actually correct the error. You can't use whiteout, you can't delete documentation. So the question then becomes, how do I correct the error? Well, the first thing that we look at is something called strike through. What it is strike through is literally a single line through a word to acknowledge that you have some sort of error. So let's say you write the word cardiac, but you meant something else. Well, single line shows that you've acknowledged the error. Then you usually put your initials and the word error. This just goes to show that you've acknowledged that it's an error that's incorrect and that you're striking through it and removing this word from the medical record without actually having to remove it. The other thing that we look at in correcting errors is something called late entry. So let's say you've got 800, you've got 1200, and you've got 2 o'clock in the afternoon, and you've got 4. And this is let's say this is your nurse's note, right? And you realize that there was some sort of event or some sort of care that you gave that happened at 11:30. What you can actually write is late entry. Literally the words late entry, 11:30, whatever documentation you need to do. And it shows that the care actually occurred at this time. You should also probably initial if you don't have the capabilities to do it. But by doing this, you acknowledge that this goes up in here, and then it still happened. One thing to remember is that your charting is being watched all the time, and everything in the documentation is being watched by everybody. It's usually by management, upper level leadership. They all see who accesses what patient charts and when and why and all that stuff. So just know that whenever you are accessing charts, only access the patient that you are taking care of, patient or patients that you're taking care of. Make sure that you follow HIPAA, because this is a violation of HIPAA. You may not be taking care of the new sick patient that's coming to the ICU, but because it's not your patient, you cannot go into that chart, and they will know if you did. Also, make sure that you're not documenting lazily or being sloppy. You don't cut corners, you use the right abbreviations. If you don't, you just get set up to be called out on it. Follow your facility policy, and then make sure that everything is timestamped. Well, when I say timestamped, it's if you have paper charting and you write something in your nurse's narrative and you write the time, make sure that there's a time and maybe a place for your initials. It's all about covering your ass, or CYA as we like to say. So this is one of my favorite things, the nursing narrative. When we talk about the nurse's narrative or the nurse's note, what are we actually talking about? In most documentation, depending on whether you have paper charts or electronic records, you're going to have some sort of checkboxes or some drop-down menus. So checkbox, checkbox, checkbox. What the nursing narrative is, it's a way for you to paint a picture of what's actually happening with your patient. And it's where it doesn't actually fit into these little checkboxes. So an example of this would be, let's say your patient has a neuro change. Well, you would write in your nurse's narrative that you called Dr. Smith, notified, right? Make sure you're legible when you're doing this. I'm just doing this as an example. But that you've discussed the neuro change and that he's going to order a CT, and you'll say something like CT ordered, new orders received. So this shows that you've actually had this conversation and what it was about, but it doesn't fit in these checkboxes. So this is what the nursing narrative does. With the nursing narrative, you want to make sure that you're charting objectively. So only things that you're doing, not I speculate or I think. It's I called Dr. Smith, we discussed the change, he ordered an ECT, and then I received the new order. The other thing you want to do is you actually want to make sure that anything the patient says, states that they feel, something that they're experiencing is put into quotes, because it's subjective information. Now we're going to look at double documenting. or double docking. And what double docking is when you document the same thing in two different places for the same care in the chart. So let's say you have a checkbox that talks about your assessment here, and you say yes, yes, yes. But then in your nurse's note, you write yes, yes, no, right? So these two things are in conflict with each other. By doing this, it does two things. First, it's time consuming. You've already done your assessment documentation in the flow sheet. Now you go into your nurse's note and you document it there. That's just not efficient. It's time consuming. So don't do it. The other thing is it potentially sets you, like we were talking about, sets you up for misinformation. So let's say this was called into court. They would say, you said yes, yes, yes here, but yes, yes, no here. What does that mean? Then you have to explain the discrepancy. It just sets you up to put misinformation in the chart, so avoid doing it. So like we said, if it's complete somewhere else, don't document it in the narrative. At the end of your shift, you should always check your charting. So you want to create a checklist. So you want to say at the end of every shift, I'm going to double check my pain assessments. I'm going to check my overall assessments. I'm going to check my restraint documentation. I'm going to check my turns to make sure that they were all documented, that they were consistent with the type of care that I've given. So at the end of the shift, everything is done, and it avoids discrepancies. It also ensures your completion of charting. That way you make sure that everything was documented and in the way that you actually gave care. Even after many years of doing this, I still do it at the end of my shift. There are so many different software systems in so many hospitals and so many facilities. We can't tell you how to use each one of them. But one thing we can tell you are a few different tips when you're using computerized charts or electronic health records. They all have shortcuts or hotkeys. So during your training, find out what those are. They make it really efficient to chart. If you can find out that there's a tab here, or you can use this checkbox instead, do it, because it just makes life so much easier in terms of charting. The other thing you want to do is every facility has their own policy regarding charting, so make sure that you chart at their minimum and also the minimum of yourself. Make sure that you're covering yourself with all of your care. Also, follow any policies regarding computerized charting. Okay, finally, there is one thing that I want to stress, and it's so really important, and I want to make sure that we talk about this and we drive this home. And it's this idea that charting is this huge, daunting black cloud that goes over every nurse, and it's just not that. It's really important, and it's an accurate reflection of the care that you give, but you also have to remember that your patient comes first, and you should never allow your charting to be worth sacrificing care for your patient. There are only a handful of instances where anything you do in the chart actually comes before care for the patient. So surgical consent, that's a good one. Like if you have to have a TDOC, we're talking life or limb. Those are really the only instances. And even then you can usually kick that off to somebody else so that you can still take care of your patient, because your patients come first. There are lots of cheats that we can use to help ourselves take notes. These things are like time tapes, right? So time tapes are a system that I've used in the past, and it's literally a sheet of paper that's folded in half, and it has my meds on one side and my overall report on the other, and I can put times and dates and everything on those little spaces to help me remember those notes. The other thing is you can actually use a literal strip of tape, pull a strip of tape off and write your times. So this is your tape, and you write, 8 o'clock, this happened, 9, this happened, 10:30, patient coded, right? But you can write all these little things down on the strip of tape, and then you have it, and you can come back and you can chart later, because this patient who is now coding is now your most important task. And it will always supersede any charting you ever do. So the other thing you can do here is, when we're talking about care, is delegate. Hey, your patient's coding, your other patient needs a bath. Go see if somebody else can help you do that. Hey, your patient's coding. Your other patient needs their pain medications really badly. Ask for help. Ask that other RN to deliver your meds for you. These are ways that you always want to make sure that your care is for your patient and for your sick patients are always you're at the forefront of what you're doing. Nursing concepts for this lesson are both communication and for health information technology. So let's recap. Number one, everything is always being watched. So only make sure that you're looking at the charts of the patients that you're caring for. If you don't, you're violating HIPAA, and we don't want to do that. If you have a nursing note and you can use a nursing note, paint a picture of your care. These are things that don't fit into those little drop boxes. Yes, and then you've got your note. Make sure that you use the nursing note and the nursing narrative to help paint that picture. Don't double document. This actually causes errors. It's inefficient. Don't do it. Also, at the end of the shift, review your documentation. Make a checklist of things that you have to do at the end of shift to make sure that those things are taken care of. And finally, don't sacrifice care ever for your patient. Never pick charting over your patient care. Okay, guys, we hope you've enjoyed these pro tips on making your charting a little bit easier. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.